On the video.
It's okay.
Okay. Alright,
But
so
move
let's see.
okay.
So you go to the board, because this is how it's like.
Make
it'll
sure the
be.
whole board is in the picture, almost at least. Okay, perfect. Good this way?
Uh-huh.
Okay. Alright. Keep yourself there. Exactly. Are you recording?
Yeah, it's recording.
Okay. Right. Okay guys, question number 1.
Which of the following devices does not change the amount of radiation to which a patient might be exposed? The film badge?
That devices that does not change the amount of radiation that the patient gets exposed to. The
Film badge.
film badge, what does it do?
It just measures the amount of radiation.
It only measures the amount of radiation that you get exposed to.
Yes.
Okay, doesn't protect you. Okay, what's the first thing that changes the amount of radiation that the patient gets exposed to? The first most important thing.
The aluminum filter.
Aluminum filter does not do anything to the amount of radiation that the patient gets exposed to.
collimator.
Lead collimator is, you mean the lead apron. Lead collimator controls what comes out of the machine. That's
Yeah, like
different.
it takes it.
What do you put or do to the patient or outside then to decrease the amount of radiation that the patient gets exposed to?
The lead
Number
apron.
1, the most important tool or thing to decrease the amount of radiation is using fast film. That is the most important and the most efficient way to decrease the amount of radiation. Second, then you can add the other stuff like using the apron, whatever, anything else comes later. But fast film first, lead apron second. Next question.
The primary purpose of taking an extraoral radiograph is to, what'd you put? I put A. View the bony maxillofacial structures.
Yeah, that's true. Very quickly, guys, X-rays could be X-ray here, or films, or radiography could be 2 types, 2 main categories, which are extraoral and intraoral. Types of extraoral, or at least the most known extraoral, panoramic and cephalometric. Okay, and panoramic, you probably know how it looks like, the one that goes around your face, puts a picture, a 3D picture of your face on a 2D picture. Okay, cephalometric is yeah, profile. Cephalometric is profile. Every time you hear or you see the word profile, lateral view, for example, ortho, tracing, the answer is always cephalometric. Okay? It's an X-ray that we take to the profile, the side of the patient, and usually it's used more commonly in ortho treatment. It's a lateral view, and then we use tracing. That means we put this film that we got from the patient here, and we start tracing it, put some landmarks here, measure some angles, the angle, this angle, this angle, whatever. There should be measurements, angles between specific areas, and that will tell you if, for example, the mandible is not growing well or it's growing too much. So this is a way to evaluate, or if you see also the growth or evaluating growth of the patient, this is the answer. Next question. Oh, sorry. Intraoral, the most famous intraorals are
The
bite wing,
periapical.
periapical,
And you have, hold on.
huh?
Hold on, right wing, periapical, and then
Occlusal.
occlusal.
Occlusal. What do we do the bite wing for? What does it look like first?
The 2 crowns including.
Yes, in the bite wing, we take a picture basically for a crown here of a tooth and a part of the root, probably a part of the root could appear to here, film would look like this here. So you see the crown and a part of the root. What do we use it for? What could we diagnose with a picture like this?
The caries that are proximal.
Very good. So it's used to diagnose caries, especially proximal caries. Class, what class?
2 or 3.
Not really. Class 3, we don't really
Because
need
it's the inside.
X-ray because you will see, no, class 3 is proximal of anterior.
Oh, yeah.
We don't really need to have class 3 X-ray to diagnose class 3. Usually you could see it on the patient. It's mainly for class 2, which is proximal posterior teeth. You can use it for other 2. You could see also some other types of caries, but it's most useful for diagnosing class 2 or caries. What else? There's another thing. Perio. Because here it will show you the bone level or the bone loss that you have here, so you can use it to judge. And this is the most common type. That's another question. What's the most common type of X-ray that's taken for perio or to evaluate perio condition is definitely going to be the bite. Okay. Second is periapical. What do we use it for? What appears in the periapical? What does it look like first? What do you see?
Whole tooth and the root.
Yeah, you see one tooth, crown and root, plus you see an area also around the apex. Okay, so this is called periapical. We use it for diagnose, right? The tooth or hey, what's up? What's up? About an hour. An hour. Oh, it's closed. Can you open it?
Video going.
We're recording. Okay. So, fine. So, with periapical, you will see the crown and the root that helps you to diagnose. What can you diagnose on it?
I'm the whole like abscess or like for root canal.
Abscesses, yes.
Endodontic.
Endo treatment.
Pain if you have any.
Caries. Also, perio could be also evaluated from the periapical. Occlusal. What do we use the occlusal for?
That is an answer for the erupting teeth. No, not erupting teeth. I take that back. It was I don't remember. Something to do. You saw like a little bit of the apex of the tooth. You saw like the whole occlusal top and their jaw.
Yeah, in the occlusal, what you see is basically here a picture from the occlusal surface of the teeth, like this. You don't really see the roots, you don't see the periodontal ligaments. When do we use occlusal X-rays?
No, it was they said they use it for not when you're younger. Oh God.
Sinuses, if you want to see the sinuses, maybe?
Yeah, sure. If you want to see the sinus,
I'm
yeah.
always thinking that.
Yeah, the most common things for occlusal. First of all, the most common use for occlusal is if you cannot take bite wing or periapical.
Oh.
So that's why we use it with pedo. For a young patient, the easiest way is just to take an occlusal film. That will save some time, will give us an idea about his mouth as well. So that's one use for it. Another very important use is, as you can see, this is the view, impacted teeth. When you see an impacted tooth here, on a periapical, for example, you're gonna see the tooth like this. Do you know where this tooth is? You don't really know how it's positioned. But if you see it on an occlusal picture, you will see exactly how the tooth is positioned very easily. So that's a very important use too. So used for impacted, very important, impacted teeth, and very, very important, use also for diagnosing stones. When I say stones, I'm not really talking about old stones. It's used mainly for sublingual salivary stones, or could be also in a canal there, but just what we usually talk about is sublingual stone, because you have it right here under your tongue. So if I put the film here, take a picture, the stone will appear here as radiopaque or radiolucent.
Radio lucent as a No, a
No,
stone
it's
is
a stone
dense,
that's
opaque,
dense.
or
Yeah.
radiopaque.
Stone, there is minerals in it, definitely it will look radiopaque. So this is a very good or easy way to diagnose and locate as well, know the location for a sublingual stone. Sometimes the question just say to diagnose stones or salivary stones only. It's not used to diagnose, for example, parotid gland stones. But once if they say stone or salivary gland stones, usually this is the right answer. Okay, so this is the main. It's like a brief idea about all types of X-rays. Next.
I changed my answer from wrong to right with that one. It said impacted canine for the occlusal, and it would.
Yeah, that would be the right option then. Okay, next question, guys.
Which
Yeah.
Which of the following should be present in a diagnostically acceptable panoramic radiograph?
Diagnostically acceptable panoramic. What would you see in a diagnostically acceptable panoramic X-ray?
Isn't it like, the line's not straight, it goes like a little up.
What are the options you have?
It says a plane of occlusion should form a straight line.
Which I
Okay.
think is right.
Incisal overlap should be present. Patient should be symmetrically aligned. Removable appliances should be shown in proper positions.
But you're supposed to
The
remove
question
it.
is asking what should be there.
Yeah,
Yeah.
Okay, let's take them one by one. First one,
the plane of the occlusion should form a straight line.
not ever. You can never do it straight.
It's a little
No
bit.
way. There's gonna be a slight curve, but it should not be very clear. Like you should not see the patient with a smiley face like this,
Right.
or with a sad here. This is the patient, or with a sad face. Okay, you can never see. Those are two errors. That's a common question. When you see a panoramic with a smiley face, the problem is here. That's my space between upper and lower, right?
Right.
When would you see a smiley face? Take a picture this way while my chin is down, you'll see it smiling. If my chin is up, you're gonna see it as a sad face. That's a very common question. Smiley face means chin, where up or down, down. And sad face is chin up. Okay? Remember, this is an important question. So the first one is not right. Second,
The inside.
Incisal overlap should be present.
should we do incisal overlap?
If you bite on the thing, I thought it's like a.
Exactly. That's why we bite. So we make sure. That's why we put something between your upper and lower teeth to make sure there is no overlap. So definitely the second one cannot be the answer.
Patient should be symmetrically aligned.
I think so.
Makes sense, right?
Yes.
You cannot. Do you see an X-ray with the patient like tilted? Like it has to be
The red light.
symmetric. What's the fourth one? Just in case. Let's.
Removable appliances should be shown in proper position.
Definitely, you should remove the removable
Right.
appliances. Okay.
So C is right.
Next.
Okay. Scattered radiation is produced.
A, during all exposures, only when MA is increased, only when KVP is increased, only when the MA and the KVP are both increased.
What did you choose, guys?
During all.
During all exposures.
Scatter radiation will be during all types of radiation, no matter if it's a high kilovoltage or high milliamperage, it doesn't make any difference. What is scatter radiation?
It's what it deflects off of the patient or an object or.
Yes, exactly. This is the interaction between the X-ray and the matters. Whatever, you or the chair, the dental chair, the X-ray would hit whatever object and then will scatter. Basically, it hits an electron in the atom, could cause ionization, and then the rest of, or the leftover of the energy will spread into the room again to do the same cycle over and over. Okay? But again, that happens in the same second of pressing on the button. Once you release it, these things happen very fast that once you release it, nothing is left. Okay?
A dental X-ray film badge is a device to monitor A, kilovolts, B, milliamperes, C, radiation exposure, D, exposure time of X-rays. C, radiation exposure.
Yeah, radiation exposure, it's a badge, just it
Measure.
would measure whatever amount of exposure that you got exposed to, no matter how high or low it is. Next.
The lead foil in a film packet helps to prevent the image from being magnified, light, fogged, or blurred.
What did you choose? That the lead foil behind the film. You know, your film, an X-ray film, usually looks like this here. This is the packet of the film. Okay, looks like this. If you see what's behind this, if you open it and see what's behind, you'll see. What are you gonna see first?
The
Black paper.
Black paper first. What's the use of that? First of all, what's the use of the packet here? Protection. Okay, protection from everything, light, humidity, everything. And then you're gonna see a black paper. What's the job of the black paper?
To hold everything in, or the paper that
No, no. Black paper. Why are they putting black paper?
Keep the light out.
Light. Yes, to protect the film from the light. What's after?
It's the foil.
No. It's the film.
When the envelope's part's facing you.
Oh. Thank you very much.
I was just like, I'm so confused.
You're right. Okay, let's do the other way. This is where the exposure happens. We
Okay.
expose the film in this direction.
So,
So first is black paper,
then the film.
and then the film, and then
The lead
The
foil.
light foil.
black paper again.
Oh, yeah,
Oh,
And then the lead
Then the
foil.
lead foil.
At the beginning, it doesn't make sense if you protect the film from light on one side and then it gets exposed on the other
On the
side. It
side,
doesn't
right.
make sense. So
Yeah.
black paper, film, black paper, and then
The lead.
lead foil. Exactly. And then will be the other side of the packet, right? Which is, I drew in green here, so that's the other side of the packet. So here, according to from the direction of the X-ray will hit the packet first, and then black paper, and then film, and then another black paper, sandwich. Black paper, the film is in between, and then goes the lead foil, and then goes the rest of the packet. So here the X-ray will pass through the packet, the black paper, the film, and then another black paper, and then will be absorbed by the lead foil. If there's no lead foil here,
It goes through and it makes it the
then the film will get through, go there to the back, hits whatever is there, other teeth, other structure in your mouth, and then scatters back to the film, making another image of whatever, anything. So that will cause the film to look
Blurry.
foggy.
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 Okay.
Imagine you're having other pictures of other things, not blurry. Blurriness is caused by one thing, blurry. When do you receive or get a blurry picture on your phone when you take a picture for your friend?
Distortion.
If your hand is moving, or the phone is
Or
moving,
they're moving.
or your friend is moving. Same thing. If you have blurriness is caused only by movement, nothing else. Blurry. Picture means movement of whatever. The film, the patient, the X-ray machine, whatever, anything, which is the tube head. So don't say blurry, it's gonna be foggy, okay? All right, next question.
If the operator cannot leave the room when exposing a radiograph, which of the following is considered the safest position for the operator to stand? A, in front of the patient, B, behind the patient, C, 6 feet away from the patient, or D, behind a lead
The
bag?
key is 6 feet away from the patient, okay? This is the safest way for you guys to make sure you're not getting exposed to X-rays. Stay away 6 feet, okay? Not behind the wall or anything. Behind the wall is better, definitely, but make sure you have your 6 feet, okay?
This says if you cannot leave the room.
Yeah,
How far would
6
you
feet,
stand? So 6 feet
exactly.
in. So barriers on the X-ray exposure control panels are recommended because
Why would you put a barrier
on anything.
on anything?
To protect it so that you can reduce the need for your gloves. Only for certain situations.
Not really wrong. That's
Really?
not the reason why.
I chose
It is-
that
Why?
one for this one.
What's
It's
gonna happen
direct-
if you remove these barrier from this, they are talking about control panel,
Right.
where you set the radiation, the kilovoltage, everything. Why do we put, you do so, right? In our clinic,
they are
you
there.
have barrier. Why do you have barrier? What if we remove it? What's gonna happen?
So we'll have to clean it all the time.
Okay, what if we clean it all the time?
We'll mess up the machine.
Okay.
Why?
From the spray.
Exactly.
The
You will have, if you don't have barriers covering the control panel, you will have to wipe or spray the machine. Okay?
This is a horrible question because you can't see the picture.
Don't worry about it. Go to the next one.
Which of the following KVP settings will create the most penetrating x-rays? 90, 80, 70, or 60?
What did you choose there?
90.
Why?
Because it's the
Because it's the
highest.
highest.
Okay. Yeah, absolutely. Let me explain this part. Can you make sure we're still on? Nothing happened. Actually, can you stay there? So.
Sure.
All right. So this is an important part, and I promise you to find about maybe 10 to 20% of the questions of your test will be related to that subject that I'm going to explain. Please understand it. Okay, I'll explain how the X-ray machine works. All right, the X-ray machine simply is formed of what's this?
That's the cathode. The
That's called the
filament.
cathode. Yes, cathode. Cathode is basically